Okay, self-assessment for the fifth chapter. Mental health service provision. The first multiple choice question: which patient is least likely to need secondary mental health service? Which patient is least likely to need secondary mental health service? Which means it's just in the primary care, usually. A. A 34-year-old woman with a first episode of depression responding well to cognitive behavioral therapy. It seems that this is the answer. Okay. But B, a 34-year-old woman with first episode of depression who has not responded to cognitive behavioral therapy or to antidepressants. C, a 34-year-old woman with a first episode of hypomania and previous episodes of depression. D, a 34-year-old woman with a first episode of depression who recently took a planned overdose. E, a 34-year-old woman who says she has been depressed for years but objectively seems euthymic. And the answer is A, because here we have a patient, first episode of depression, and she's responding well to cognitive behavioral therapy. The other options demonstrate treatment resistant, like, B, this is treatment resistant. C is bipolar. D, we have significant risk. E, uncertainty about the diagnosis, all of which means referral to secondary care should be considered. But the first option is not. Question number 2. A 21-year-old man with no past history is experiencing odd beliefs that he has some special power and that things around him are of special significance. He struggles to explain these beliefs further and says they cannot be true. He has stopped going out with his friends and his personal hygiene has deteriorated. He has no thoughts of harm to himself or others. So which team should he be referred to? A. Community mental health team. B. Early intervention in psychosis team. C. Assertive outreach team. D. Home treatment team. E. Inpatient unit. And the answer is B. Early intervention in psychosis team, because we're not talking about full psychotic symptoms, but we have something like that. So this man may be experiencing prodromal psychosis. He does not currently appears to be at high enough risk to require, for example, home treatment or admission, as he does not have an established diagnosis of mental illness. And an assertive outreach team is not appropriate here. For the option number A, for example, a community mental health team could manage him, but early intervention teams are expert at this case, to identify early psychosis, and are therefore best placed to monitor him. So this is the most appropriate answer. Yes, it could be the community mental health team. Let's talk about the extended questions. Choice of service provision for mental disorder. So we have these units, and from each case below, select which service they should be referred to. These services are acute general adult inpatient unit, assertive outreach team, community mental health team, day hospital, early intervention in psychosis team, home treatment team, liaison psychiatry review, outpatient clinic, primary care, and rehabilitation unit. So, for the first case, a 24-year-old man with a first episode of moderate depression. Moderate depression would be treated in primary care, because most episodes of depression are managed in primary care, actually. Referral to secondary care should be considered in cases when there is cases with treatment-resistant depression or high risk of for example, suicidality, or if there is any uncertainty about the diagnosis. So primary care is the answer. The second case, a 24-year-old man who is an inpatient on a gastroenterology ward with inflammatory bowel disease. He is low in mood and fatigued. And here the answer is, of course, liaison psychiatry review. Liaison psychiatrists provide psychiatric care for people admitted to general hospitals. And this man may be experiencing a depressive episode, symptoms of physical illness, side effects from medication, or an adjustment reaction. So a liaison psychiatrist would do the job. The third case here, a 34-year-old man with schizophrenia. Today he attempted to hang himself because he is terrified the secret services are planning to torture him. And of course, here we are talking about psychotic patient, so the answer would be acute general adult inpatient unit, because this man is in high risk and therefore requires hospital admission actually, and he cannot be safely be managed at home. And of course we are not talking about this early intervention in psychosis team. No, we are talking about inpatient unit. As for case number 4, a 34-year-old man with schizophrenia who is currently an inpatient on a general adult ward. He has been taking a therapeutic dose of clozapine for 12 weeks, but has ongoing auditory hallucinations. He has not been in employment since the onset of his illness. So this man has treatment-resistant schizophrenia, of course, with ongoing symptoms despite the appropriate treatment. He is on clozapine. He also has functional impairment, so I think a rehabilitation unit will be able to optimize his ability to live well despite ongoing symptoms. So the answer would be something about habilitation. Yes, rehabilitation unit. Okay. So the last case here, a 34-year-old man with schizophrenia who is homeless and injects heroin. He frequently attends accident and emergency reporting auditory hallucinations, but has not attended numerous appointments with his CP and psychiatrist. So here we need the assertive outreach team, because this man has schizophrenia with complex needs, because he is homelessness, comorbid substance use, poor engagement, frequent use of crisis services, and so on. So he needs intensive support for ongoing symptoms. So that's why we need the assertive outreach team. The assertive outreach team. Yes, community mental health team, but it's unlikely to be able to support him as well as assertive outreach team, because assertive outreach team is the appropriate and the skilled team to do what we want for this patient.